Dear students, welcome to your course 415, Growth and Development, Mental Health for Adults and Elderly. So before we get to the meat and potatoes of your course, let's talk about the basic health nursing concepts. So today we'll be meeting some concepts, some objectives. We will be talking about the difference between mental health and mental illness. We will also be talking about how mental illness was viewed historically. We will also be talking about the DSM-5, which is used to diagnose psychiatric conditions. We will also identify how culture influences the view of mental health. And last but not least, we will assess and interpret psychological needs of adults and elderly. So what is mental health? Mental health is overall a state of well-being, and it's completed when physical, mental, and social well-being is intact. And an individual feels that he or she can maximize her or his potentials and contribute to the society or the community fruitfully and productively. And they can feel that they can be held accountable for their actions, they can make sound judgments, and they can be loved, and they can love, and they can respond with humor when life gets tough. They can function well alone, and they can function well with other members of the society. Now let's look at the historical perspective about mental health. So historically, when there was any mental health, any evidence of mental health, it was attributed to the possession by evil or demonic spirits. It was thought that it was because of the displeasure of gods. It was thought to be a punishment by God because of the wrongdoings. It was also thought to be contributed because of the substance abuse. Um, it was managed sometimes to be, the help was sought through turning to faith healers. Many times the problem was just denied altogether. People would hide their loved ones who would have mental illness. In many cultures, mental illness is viewed differently. Many times, like I said, that it is viewed as possession by demonic um, or demonic possession, or probably it's viewed that evils have possessed a person. But many times there are some elimination strategies. If it's considered an illness, there are some elimination strategies. People would turn to God and they would pray. They would use touch, or they would use some traditional medicines and some religious rituals. Sometimes some religious music is used. People would talk to God. Some meditation techniques are utilized to eliminate the illness. Sometimes magic is used. Folk healing customs are utilized. Traditional medicines and herbs are utilized. So as nurses, we have to be mindful about different cultures and the point of view about the mental illness. So as we have viewed the historical perspective about the mental illness, we have come a long way. Now we have American Nurses Association, we have American Psychiatric Association, as well as International Society of Psychiatric Mental Health Nurses. And these are the associations and organizations who have set standards of care for mental health. And then, as nurses working in mental health settings, we should utilize the nursing process as well as the holistic approach. And we talk about holistic approach, keep in mind that we are talking about mind, body, and soul. Because when patients are affected by mental health issues, their physiological health is also affected. So how do we actually diagnose mental health problems? We do have a um, golden criteria, we should say golden standard, and we call it the Diagnostic and Statistical Manual of Mental Disorders, which is the fifth edition, and it is published by American Psychiatric Association. So it is used by mental health professionals. What it is that it includes expected data collection findings for disorders that we see in typical clinical settings for all of the mental health problems that are commonly seen in patients who have health problems. And we use those findings, clinical findings, to diagnose our patients for certain health problems. And then we use that data to actually implement the care interventions and then evaluate the care. And according to DSM-5, a serious mental health is defined as a severe persistent mental, behavioral, and emotional illness where patients often have difficulty sustaining activities of daily living. And they are usually lifelong disorders that can have remissions and exacerbations. So they are so severe, the extent and magnitude is so severe that patients have impaired functional lives. We also use mini mental state examination. What it does is it actually takes into consideration several different factors when we are assessing patients. We look into their orientation to time and place. We look at their attention span, and then we also look at their ability to count backwards. We ask them to count backwards up to 7. We also look at their memory, their ability to recall the name of the objects. We look at their comprehension and their language skills, how they can name the objects. Can they follow the commands? Are they able to write properly? When we look at the mental health, we have to consider the lifespan. When we are talking about mental health and we are considering mental health among children and adolescents, usually healthy children and adolescents, they trust others. They look at the world as a safe place. And when they go through some sort of mental distress, their coping strategies are rather appropriate. They use appropriate coping skills. So when we are collecting data, when we are assessing their mental health, we have to keep their temperament in mind. We have to see what kind of social and environmental factors are around them. Their culture and religious concerns should be considered. Their developmental level should be assessed. We should be gathering information from the patient themselves, but their caretakers should be historians too. And also we should be gathering data from their parents too. Children and adolescents usually they undergo same kind of mental issues as adults and elderly do, but sometimes their diagnoses are delayed and oftentimes it's difficult to implement appropriate interventions because many times they're not able to communicate their symptoms appropriately. So this is a challenge when it comes to children and adolescents. So a thorough assessment is of utmost importance. So when we are collecting data from children and adolescents, there are some factors that we have to keep in mind. We have to look at their home environment, who are they living with, what are the conditions, what educational level they are at, are they working, what kind of activities they have, uh, who are their peers, what kind of pressure they are under, are they using drugs, are they sexually active, are they depressed, do they have a safe home environment, what kind of social support do they have. For adults and elderly, however, in addition to the factors that we had just discussed, we should also look at their functional abilities, if they can carry out the activities of daily living, if they can independently get dressed on their own, or if they can manage simple household tasks on their own. How is their economic and social status? A lot of elderly, actually suffer from social isolation because they have lost their loved ones and family and friends. What are their environmental factors? Sometimes just access to the simple uh, life activities is difficult. If such as just having a stairway in the home, can they go upstairs and access the bathroom to take a shower or bath? That can impact their well-being. What kind of home environment do they have? Are they depressed? Do they live in a safe environment? So just keep those things in mind when you assess elderly. So we'll talk about all these therapies when we will have our face-to-face session in class, but there are some things counseling when mental health, when we offer our patients help. Counseling milieu therapy is actually, it's based on therapeutic communication and therapeutic environment, which is basically providing a safe environment. Promotion of self-care activities, just promoting and empowering patients to take care of themselves. Psychobiological interventions and pharmacological therapy, it's based on medications. Keep in mind that mental health also impact physiological health. So medications and pharmacological therapy should not be ruled out. Cognitive and behavioral therapies, modeling and operant condition, systematic desensitization. These are the therapies that we will discuss in details as we progress through the course. Health promotion and health maintenance. As nurses, and especially in mental health, no opportunities should be left out when it comes to patient education. Case management and social workers, again, it is very important to provide holistic care. Always remember mind, body, and soul. We are responsible to provide holistic care to our patients. So one thing I want to focus on milieu therapy. When we talk about milieu therapy, we will focus a lot on therapeutic communication and therapeutic environment. And that's what milieu therapy actually focuses on. So every incident and every interaction with your patient should be an opportunity for milieu therapy. And we will talk about it more further in detail. Also, I would like to focus on patient-centered care. So as we go along in this course, we'll talk about it a little bit more. So let's just try a practice question and just we'll recap our lecture a little bit. A nurse in an outpatient mental health clinic is preparing to assist with an initial client interview. When conducting the interview, which of the following actions should the nurse identify as a priority? Coordinate holistic care with the social services, identify the client's perception of their mental health status, include the client's family in the interview, instruct the client about their current mental health disorder. Now, if you look at this question, and if you look at it, the question is asking about the priority. So, and then now you read the question again. So coordinating the holistic care with the social services might be a good option, but it's not the priority this time. Including the client's family in the interview may be a good option too, but it's not the priority because we haven't even conducted the interview with the patient yet. Instructing the client about their current mental health disorder is probably we're getting ahead of ourselves. So identifying the client's perception of their mental health status would be the best option. Let's see. So option B is the best option. Data collection is the priority action when using the nursing process approach to client care. Identifying the client's perception of their mental health status provides important information about the client's psychosocial history. And also keep in mind that your client's perception is the most important thing. When you're interviewing a patient, the patient's perception is the most important thing. When we're talking about patient-nurse relationship, it should be always patient-centered. The communication should be patient-centered, the relationship should be patient-centered, the plan of care should be patient-centered, the interventions should be patient-centered. And we will go into more detail as we progress through class. So hooray, you got through your first lecture. Thank you for sticking around with me. And if you have any questions and concerns, feel free to reach out and I will see you in our face-to-face session. Thank you. Bye-bye.